The family of a 13-year-old girl declared brain dead by several doctors has reached an agreement with the hospital to transfer her, but the details have not yet been worked out. Yesterday, a California coroner issued a death certificate for Jahai McMath. The date on it is December 12th, 3 days after her tonsil surgery. Chief Medical Correspondent Sanjay Gupta explains brain death.
Well, this is obviously an incredibly sad and heartbreaking situation. It's also very confusing for a lot of people. So let's start off by talking about some of the terms here. Brain death. Brain death is not the same as being in a coma or a vegetative state. Brain death, by definition, is irreversible. Now, in the United States and most places, it is legally synonymous with death, the same as if your heart stops. But brain death means a total loss of brain activity. Now, to determine it, doctors will often do several things. A physical exam, for example, shine light into the pupils and see, do they dilate, do they move and constrict? Gently rub the eyeball with some cotton and see if the eye reacts that way. Sometimes they'll put ice water into the ears and see if the eyes move in a particular fashion. These are all tests of the brain stem. They'll also do something known as an apnea test. That means they turn off the ventilator for several minutes and see if the person shows any signs of breathing on their own. As confirmation, oftentimes they'll do scans to check to see if there's blood flow to the brain and also test to see if there's electrical activity from the brain. But again, it's that detailed clinical neurological exam that is so important. Now, coma, if it goes on for an extended period of time, is called a vegetative state. And there's a fair amount of interesting research in this area. In a rare handful of cases, for example, people who have been in a vegetative state for years have returned to some level of consciousness. This is rare, but it does happen. But again, brain death is something else entirely. There is no activity in the brain. There is no blood flow to the brain. It is a grim situation, but again, something that a trained doctor can pretty easily diagnose. Back to you.
All right, thanks so much, Sanjay Gupta. So as you can see from Sanjay's report, a lot of people have been very confused about what exactly brain dead means. And my guest says we need to talk about that. I'm joined now by bioethicist Arthur Kaplan. He's the director of the Division of Medical Ethics at NYU Langone Medical Center. Good to see you again, Dr. Kaplan.
Thanks for having me for drinking.
So this is clearly a tragic case, of course, and we feel for the family. Everyone does. But you say this confusion about the terms brain dead and life support leads to the outcome that really makes no sense in your view ethically. So we heard Sanjay's explanation. Brain dead really does mean dead. So why even use that terminology? And what do you mean when you say it really makes no sense ethically, this predicament?
Well, the predicament we're in is that the family can't accept the death. You know, their little girl went in for an elective operation. She's died. They find it really tough, and they're religious. They're hoping for something to happen. I understand that. It's tragic, but death is death. Brain death is one way that we can diagnose it. Stopping when your heart stops is the other way. It's been confirmed many times in her case. Now we have the coroner saying she's dead. We know she's dead. So I think we don't have a disagreement about the facts. What we have is a problem of trust and acceptance on the part of that family. So that's why I say it doesn't make ethical sense. We don't treat the dead. We don't ask doctors to do that, and we shouldn't ask doctors to do that.
Well, I think most people can understand a family is holding out hope. A family is holding out hope that maybe something will happen to their loved one and a turnaround will take place and I'll have that loved one again. So when a doctor says brain dead, that seems like there's an underlying reason to have some hope. But if you and Dr. Sanjay Gupta are saying brain dead means dead, no blood flow to the brain, that there really are, there is no hope for this person's life to turn around, why do doctors even use the term brain dead? Why not just simply be frank with family members and say, there is no turnaround for this person?
That's a really great question, and I think they should not use the term. I think what they should say to the family is, your daughter, your loved one has died, and we've determined that using brain death criteria. Similarly, we're talking about life support. You can't keep a corpse, a dead body, alive. You can maintain blood flow, you can mimic certain things about life, but when you hear that term life support, as this family apparently has, they're sort of thinking, well, why would I stop life support? So you got to be very, very careful trying to teach doctors, be careful on the language here. You don't want to build false hope or confusion. Use death, not brain dead. Don't talk about life support when death has occurred.
All right, Dr. Kaplan, thanks so much. Always good to see you. Appreciate it.
My pleasure.